Thank you for joining us for this episode of Leading by Example, an informational video series where subject matter experts from Spectrum Healthcare Partners and Spectrum Management Services Company provide guidance and other resources to help patients, providers, and communities on timely healthcare topics. The COVID-19 outbreak has put a spotlight on patient safety. Healthcare organizations across the world have needed to adapt quickly and operationalize new safety and screening protocols almost overnight. Quality teams and operational leadership at provider organizations are working to overcome obstacles to continue treating patients safely. In today's segment, Miriam Dowling-Schmidt, RN, Spectrum's Director of Quality, shares information about what it means to be a high-reliability organization and how these key principles are particularly relevant during the COVID-19 pandemic.
Hi, I'm Miriam Dowling-Schmidt, the Director of Quality here at Spectrum Healthcare Partners. I'm also a clinical ICU nurse by training. Thank you for joining us for this segment of Leading by Example. I'm looking forward to talking to you about high-reliability organizations and the COVID-19 crisis. During times of uncertainty, truly great healthcare organizations actually excel. For people who don't work in one of those organizations, it can seem impossible to keep going and continue to treat patients, but the truth is that resilient clinicians aren't really superheroes, they're just regular people who are very well prepared. When we first got word of the COVID-19 outbreak in China, our chief medical officer pulled me aside and said that we need to get ready just in case. Dr. Cushing has been a leader in all kinds of uncertain situations like H1N1, Ebola, and the Amtrak train derailment in Philadelphia. He stays calm under pressure, takes what people say at the front lines very seriously, and prepares for the worst. As a less experienced leader, I made it through H1N1 and even Ebola without much thought, so I downplayed COVID-19 as something that couldn't possibly be worse than influenza. In hindsight, I realized in that moment I was failing to implement the high reliability principles which our organization is striving to adopt. Highly reliable organizations are organizations that make fewer than their fair share of mistakes despite being highly complex in nature. The common examples of HROs are nuclear power, naval aviation, and commercial aviation. If commercial aviation had the same error rate that we have in healthcare, we would see a 747 crashing every day. That would be completely unacceptable. They prevent this type of daily catastrophe by implementing 5 common principles. Those principles are a deference to expertise, sensitivity to operations, commitment to resilience, preoccupation with failure, and a reluctance to simplify. As the spread of COVID-19 and the inevitability of spread to Maine became evident, I realized Dr. Cushing, the physicians and employees of Spectrum, and the high reliability principles would get us through this. We learned that by applying the HRO principles, we could have a plan of action ready to go before the wave ever hit Maine. We found experts and listened to what they had to say about how we could approach COVID-19. We have presence on all local and even some federal CDC calls and have consulted with other governing bodies within our specialties in order to get the right information, such as AORN and ASCA. These experts have helped us with our approach to COVID-19. We have daily calls with a multidisciplinary COVID-19 task force within Spectrum. We get updates from each clinical and administrative division to make sure they are getting what they need and they can stay safe and keep our patients safe. We are constantly asking what if and preparing for the worst. What if we run out of N95s? What if we have patients who need to have an orthopedic surgery and they're COVID positive? Do we have the right policies and procedures? Have we done drills to keep our patients and our staff safe? We have learned from Dr. Cushing and other experts that this is not just a bad cold. There isn't a simple solution, and we can't just wish this away. As soon as we had to start rescheduling non-urgent surgeries, we had to think about what it would be like for a patient to come back into a medical setting after something scary like COVID-19. We want to make sure that our staff and our patients feel cared for and that we have enough personal protective equipment to take care of everyone and make them feel welcome back into our clinics. Thank you for joining us for this episode of Leading by Example. Again, my name is Miriam Dowling-Schmidt and I'm the Director of Quality here at Spectrum Healthcare Partners. If you have any questions about what I discussed today or would like to learn more about the resources that may be helpful to you, please contact us.